Everyone, welcome to another video. In today's video we'll be looking at a very rare case, a very rare condition, and is known as Dupuytren's contractor. So this condition known as Dupuytren's contractor is actually a progressive hand condition that particularly affects the connective tissue under the skin of the palm and the fingers. It gradually thickens and tightens, pulling the fingers into a bent position, making it difficult to straighten them. So basically the fingers will be like this in this condition. So it is actually a slow, painless process, often developing over months to years, and it is most common in men over the age of 50 years, especially those of the Northern European descent, and this condition tends to run among families, so it's a genetic disorder. So when we are looking at the anatomy and the physiology in respect to this condition, so basically the palm of the hand contains a tough layer of tissue called the palmar fascia, and this fascia helps support the skin and gives strength to the grip. So in Dupuytren's contracture, this fascia becomes thickened, scarred, and shortened over time. So the thickening forms nodules, that is small lumps, and cords under the skin, mainly over the ring finger and the little finger. So as the cord tightens, they pull the fingers towards the palms, causing the contracture, that is a permanent bending of the fingers. So what exactly causes this condition? Well, the exact cause is not fully understood, but several factors are linked to this Dupuytren's contracture. So for example, like I mentioned earlier, due to genetics, so having a family history of the condition, and age too, like is more common among people over the age of 50, and is more common among men compared to women, and sometimes can be ancestry. So there is a higher risk in people of Northern European descent to have this condition, and there are other factors like alcohol consumption, smoking, diabetes mellitus, epilepsy, and long-term use of anti-seizure medicines. So for the pathophysiology, the process actually starts with an abnormal thickening of the palmar fascia, possibly triggered by fibroblast proliferation, that is increase in the fibrous tissue cells. So this forms nodules in the palms, and these nodules develop into fibrous cords that shorten and pull on the skin and the fingers. So over time, the contractures they develop, usually affecting the ring finger and the little finger, especially compared to other fingers. So the fingers become the fingers become permanently bent towards the palm, limiting the use of the hand, so limiting hand function. So looking at the signs and the symptoms, there will be presence of painless lumps or nodules in the palm, often near the base of the fingers. Then over time, there will be formation of cord-like bands around the skin. Then there will be flexion contracture, that is the fingers bending towards the palms and cannot straighten, the fingers cannot straighten fully. Then it most commonly affects the ring finger and the little finger, so there will be the fingers that will be affected mostly in this condition. And then there will be difficulty in gripping objects, in shaking hands, or in placing the hand flat on a surface. So you can't place your hand flat on like a table. So these are the common problems that someone that has this condition would encounter. So other conditions that can cause hand stiffness or nodules and can mimic some symptoms that we see in this Dupuytren's contracture. We have for example, arthritis of the fingers. There's something that is called trigger finger. So this is a condition where the finger gets stuck in a bent position, like bent position. So it's called trigger finger. Then flexor, when the person has flexor tendon injuries, and if there's presence of ganglion cysts, so that is fluid filled lumps. So all these other conditions, they can cause hand stiffness and they can cause nodules. Then for the treatment of this Dupuytren's contracture, there's actually no cure, but treatments aim to improve hand function. So for mild cases and where we use non-surgical treatments, so first we have to observe first if the condition is actually mild or if the condition is severe. So we observe how we observe the patient, we observe how, like, we look for the physical signs of the condition. So we could also give steroid injections to reduce inflammation in the early stages of this condition, and enzyme injections too, that particularly breaks down cords, allowing the fingers to straighten, and the enzyme is usually injected into the cords, followed by manipulation of the finger like a day later to check if the injection is working. So for surgical treatments are usually for more severe cases, and they include, like, for example, fasciotomy, and this is basically the cutting the thickened cords to release the contracture, like release the bending of the fingers. And then we also have, besides that fasciotomy, we have fasciectomy, and this one has to do with removing the thickened cords and nodules entirely. And we also have skin grafting. So in some cases this is used if the skin is too tight. Then basically for the management and prevention, regular monitoring. So mild cases may not need immediate treatment, and we also encourage hand therapy. So after treatment, hand exercises and splinting may help maintain the finger mobility. Then patient education too is good to explain the slow progression and the importance of early intervention if symptoms worsen. And presently there is no proven prevention for this condition, but limiting alcohol intake, avoiding smoking, and managing underlying conditions like diabetes may actually reduce the risk of getting this condition. So in summary, this Dupuytren's contracture is a progressive condition where the palmar fascia thickens and contracts, leading to permanently bent fingers, especially the ring finger and the little finger. So it is painless at first, but can eventually impair hand function. Treatment usually includes observation, enzyme injections, or surgery, depending on the severity of the condition. And so as healthcare providers, whether pharmacists, doctors, nurses, we have a key role in educating patients, discussing treatment options, and also guiding them to seek medical advice early if they notice any symptoms, like, for example, maybe in this case, if they notice lumps or they notice difficulty moving their fingers. So yeah, that is basically it for this topic. So I'll see you in the next video. Thank you. Bye.